When you go to the hospital for any kind of procedure, do you understand exactly what's going to be done to you? Well, now lawmakers in Sacramento are considering tightening up regulations concerning CAT scans. Once again, a good afternoon. I'm Chuck Henry.
And I'm Colleen Williams. This comes after hundreds of patients were exposed to possibly dangerous levels of radiation during routine CT scans. Dr. Bruce Hensel is here now with the story, plus some advice on really how to protect yourself, how to know what you're getting. Dr. Bruce.
Yeah, this is real, and you need to know when you go for a CAT scan. Michael Heuser's case has been documented and confirmed by the hospital. As you heard, he is just one of hundreds of patients at hospitals around the country who was exposed to radiation overdose. 53-year-old Michael Heuser was in relatively good health until July 4th last year, when suddenly
this numbness came over my hand, and shortly thereafter, literally within a matter of seconds, my whole right side was paralyzed. I was able to say 911, 911.
Paramedics rushed Michael to Cedars-Sinai, where CAT scans showed he was having a stroke. Treatment began, but a few days later, he noticed a strange rash all over his body, and
I had this 4-inch wide band of baldness around my head. From ear to ear.
Cedars radiologists investigated and realized he had received much more radiation than he should have gotten. The hospital said a misunderstanding led to the overdose, and in a statement said the problem went beyond Heuser. The statement said Cedars-Sinai learned and immediately reported to the California Department of Public Health and the FDA that more than 200 patients undergoing urgent diagnosis for stroke with brain perfusion CT scans were exposed to a higher than expected level of X-ray radiation. While the case is in litigation, Cedars says new policies and procedures in the plan of correction were implemented following the medical center's identification of the issue, along with other measures to ensure the incident does not recur. The CAT scans at Cedars are made by General Electric, the parent company of NBC. In a statement, GE says patient safety is our #1 priority at GE Healthcare. We offer a comprehensive and broad variety of training. Healthcare providers choose which courses are appropriate for their staff. All staffing, training, experience level, and quality control planning and execution decisions are the responsibility of the healthcare provider. When investigations revealed the same problem exists at many hospitals, possibly with many different machines, the FDA issued a nationwide warning. Dr. Lisa Watanabe, a spokesperson for the American College of Radiology, says the problem occurs because many machines are not recalibrated or checked often enough.
We don't even know till the end of the scan when the machine calculates the dose that the patient absorbed.
The California Health Department investigated Heuser's case and concluded that his health is in, quote, immediate jeopardy, end quote, meaning he could die because of the radiation.
I think the consensus is that something is going to happen to me. Brain tumors, cataracts, any other kinds of cancer.
Hoping he will survive the mistake and watch his 3 young sons grow up. Heuser is now fighting to get the legislation passed, so this will never happen to anyone else.
I'm hoping that I've got a very long life ahead of me, with the people that I love and my sons and my family.
And he's working to keep it from happening to anybody else. The Senate bill would require hospitals to record the amount of radiation used on the CAT scan so doctors can tell you what your exposure is. In the meantime, here's how to protect yourself. Ask the technician and the radiologist if the machine has been recalibrated to the lower dose before your test. Ask them to check again, no matter what their answer is, while you watch them check. Radiation is cumulative over a lifetime. Keep a record of how many x-rays you've had. Tell the doctor and weigh the risks and benefits.
Interesting advice, Dr. Bruce. Thank you. Now, if you want to know more about this story, go to our website, NBCLA.com. There, Dr. Bruce will answer some of the most frequently asked questions about CT scans. Dr. Bruce, thank you.